Auzubillahiminashaitanirrajim. Bismillahirrahmanirrahim. I am Professor Dr. Fazlur Rahman. I am a former head of Department of Medicine, Benazir Bhutto Hospital, and I was a focal person for dengue and COVID-19. Today I am going to give you a presentation on standard precautions in infection prevention and control. Infection prevention and control is expected to be at the heart of good management and clinical practice. To ensure effective protection of the public health and minimize the risk of healthcare associated infections, effective prevention and control must be embedded into everyday practice and applied consistently by everyone. All staff, both clinical and non-clinical, must be able to demonstrate good infection control and hygiene practice. Patients and their relatives rightfully expect care to be delivered in an environment where risks are proactively reduced and the control of health-associated infection is recognized in all areas of trust to be an important aspect in the provision of care. This can only happen if all the staff accept the responsibility and for their role in ensuring good infection control practices is adhered at all times. Why do we need a workshop exercising emergency infection diseases for hospitals? What we have learned from the lessons from dengue, COVID-19, Ebola and other infectious diseases threats. Unique challenges are facing to the rural hospitals where the basic facilities are lacking. Best line of defense, testing and evaluating the capacity and capabilities for infectious disease and prevention. What do we expect? What are the learning outcomes? You should know how individuals can contribute to infection prevention and control. They should have knowledge of and demonstrate the standard infection prevention and control precautions relevant to your role. They may include hand hygiene, personal protective equipment, management of blood and body fluid spillage, management of occupational exposure, including sharps, management of the environment, and last but not the least, management of the care equipment. So, what is the rationale behind this? Transmission of infectious agents within a healthcare setting requires three elements. First, a source or reservoir of infectious agent, a susceptible host with a portal of entry receptive to the agent, and a mode of transmission for the agent. There is a chain of infection. To prevent the spread of infection, break any one of the chains of the links which are present in the chain. The first is an infectious agent, that is a bacteria, a virus or protozoa. Then is a reservoir where it is going to stay, that is water and other things. Portal of exit, how does it leave the body, that is by coughing or by sneezing. Mode of transmission, transmitted through air or through mosquito bite. Portal of entry, how does this enter? Through the wound, through the skin. And then is a susceptible host. Susceptible hosts are the people who have got this problem. Now you have to do the breaking of the chain of infections. The first is, most important, is the hand hygiene. Second is the equipment cleaning. And number three, we should comply at all rates with the compliance of the precautions of infection control. There are three basic routes of transmission. Number one, direct contact or indirect contact. Droplet infection. Large droplets don't travel long distances and they're not infective over time. Spatial separation more than 3 feet. So in order to prevent the droplet infection, you should keep a distance of 3 feet from the patient. Airborne, smaller infective over time and distances. So this is how the COVID spread. This is the airborne infection spreads from the small organisms. What are the transmission-based precautions? The transmission-based precautions are designed to supplement the standard precautions in patients or residents with documented or suspected infection, colonization of highly transmissible or epidemiological important pathogens. Transmission-based precautions are, number one, contact precautions, hand hygiene, gown and gloves. To prevent droplet precautions, hand hygiene and mask are the most important things. For the airborne precautions, we had hand hygiene, negative pressure room if available, and N95 respirator mask. Now you have to do the breaking the chain of infection. For example, when a patient has got infection, they should stay at home. If they stay at home, the chances of spreading the infections to the individuals is reduced. Then we have to destroy the reservoir. For example, in dengue mosquito, it is the white in the water where they are present. So we have to destroy these. Number 3, to prevent the infection, to infect the infection, what we have to do is, when the patient has got coughing, they should protect it. Number 4 are the immune patients, that is the old age patients, patients who have got COPD. Patients should be immunized for this prevention of infection. Contact precautions. The contact precautions are intended to prevent the transmission of infectious agents, including epidemiologically important mechanisms which are spread by direct or indirect contact with the patient or the patient's environment. Healthcare personnel taking care for the patients on contact precautions must wear an isolation gown, gloves, personal protective equipment for all interactions that may involve contact with the patient or potentially contaminated areas in the patient's environment. 2 words are used. Donning, that is putting on the PPE, must occur immediately before entering the room. Doffing, that is removing of PPE, must occur immediately prior to exiting the room. The droplet precautions are intended to prevent the transmission of pathogens spread through close respiratory or mucous membrane contacts with the respiratory secretions. Pathogens requiring droplet precautions do not remain infectious over long distances in a healthcare facility, and so they do not require special air handling and ventilation to prevent droplet infection. Do always face mask. Always use a respirator, that is N95 mask, prior to entering the room. Spatial separation, keep a distance of at least 3 feet. Place a face mask on the patient for transport of the patient outside the room. Airborne precautions, they prevent the transmission of infectious agents that remain infectious over long distances when suspended in the air. For example, measles, chickenpox, TB, and of course the COVID. Patient must be placed in an airborne isolation room. This is a single patient equipped room with special air handling and ventilation capacity that complies with the specific regulatory guidelines. Monitoring the negative pressure relative to the surrounding. 6 to 12 air exchange hours, air exhausted directly to the outside or recirculated through the filtration system. Door must remain closed. Staff must wear N95 respirator mask, and visitors entering the room must wear surgical masks. These are the standard precautions. The standard precautions combine the major features of universal precautions and body secretions and are based on the principle that all body fluids, blood, secretions, excretions except the sweat, non-intact skin, and mucous membranes may contain transmissible infectious agents. Standard precautions must include infection prevent practices that apply all patients regardless of suspected or confirmed infectious status. Hand hygiene, use of gowns, gloves, face shields, eye protection, and safe injection practices. Hand hygiene has been cited frequently as the single most important practice to reduce the transmission of infectious agents in healthcare settings and is an essential element of standard precautions. The term hand hygiene includes hand washing with soap and water, use of alcohol-based products that do not require the use of water, that is more than 60% alcohol, no artificial nails for those having contact with the high-risk patients. And according to the CDC, they recommend that artificial nails and extenders should not be worn by healthcare personnel who have contact with the high-risk patient due to the association with outbreaks of gram-negative bacillus and candida infections. So, no rings. All rings should be removed. The nails should be short. There should be no nail polish, and the gloves should be, when you're using, they should not be loose. They should be snugly fitting. Hand wash. Then you can see the elbows should be bare. Your gloves should not be touching your gowns or your white coats. And important thing is, when you're washing your hands in the basin, that basin should only be used for hand washing, not for using the instruments and other things. So this should be a separate basin just for hand washing use. There are 5 moments of hand hygiene for healthcare workers. So what are the times when you need to hand wash? Number 1, before touching the patient, before aseptic procedure, after body fluid aspiration as exposure, after touching the patient, and after touching the patient's surroundings, you should always do hand hygiene. These are the required methods. So these are 11 steps. You have to take 15 seconds in order to complete both the hands, and these are given in most of the books, and you can follow these guidelines in which are mentioned over here. These are also replicated in Urdu here. Bare below the elbows. Hand hygiene is the most important method of preventing the spread of infection. All staff will need to comply with the bare below the elbows when providing direct clinical care to patients or touching the immediate patient environment. Any staff who do not work in clinical environment, for example, the house officers, the training nurse, but may need to be enter the patient's environment as part of the role, will need to have the ability to bear below the elbow and comply on these occasions. Respiratory hygiene. Practicing good respiratory hygiene can save other lives. For example, when coughing or sneezing, cover your nose and mouth with a tissue paper or a handkerchief. When you can't do it and you don't have it, or you're doing the round, you can use a bent elbow to stop the spread of infection. Always, after use of this, always dispose of in a waste bin, and decontaminate your hands using soap and water or alcohol gel. Personal protective equipment may include the following task dependents: gloves, aprons, mask, eye protection, face protection, oversuits, and they should be used in single use only. This is PPE donning. First you put the mask, the gown, then the footwear, then the eye care, and then lastly the glove should be put on. So when you put on the PPE, this is known as donning.
We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility's donning procedure. First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, a NIOSH-approved N95 filtering facepiece respirator or higher level respiratory protection, or if a respirator is not available, a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown. Tie all ties or snap all snaps. You may need assistance from another healthcare provider. Put on the N95 respirator. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown. Then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the facepiece bulges slightly. Then, while keeping your hands over the respirator, take in a quick, deep breath, checking that the facepiece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If a respirator is not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room.
And again, doffing, the same steps should be taken.
We will demonstrate one way to appropriately take off or doff PPE. More than one doffing method may be acceptable to your facility. It's important that you receive training, demonstrate competency in removing your PPE without contaminating yourself, and practice your healthcare facility's doffing procedure. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove-in-glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again, perform hand hygiene after removing the respirator.
PPE for droplet precautions. Eye protection or surgical mask. If eye prescription glasses are used, eye protection must cover over the glasses. Note, prescription glasses are not designed to protect the wearer from exposure to splash and fluid from the body and body substances. Decontamination. Following cleaning schedules, these must be displayed and go into good level of detail. Clean the equipment regularly with appropriate products, that is beds, baths, hosts, commodes, bins, mattresses, computers, phones, keyboards, reusable patient equipment. No body is too posh to wash. Clean after use the stethoscope, etc. Management of shops. What do you mean by sharp? Any sharp object that could break the skin, for example, the needles, the scalpels, etc. All sharp objects must be discarded into an authorized marked bin of appropriate size at the point of care. Dispose directly into the bin. Put in gently, sharp end first. Do not put sharps into plastic bags. Once 2/3 is full, remove the bin. Closely secure the label. Do not seal with tape. Do not attempt to retrieve items out of sharp bins. Do not empty out the contents of the sharp bins. Do not place sharp bins inside clinical waste bags. All incidents regarding sharp bins must be reported to the manager on duty, and an incident report form should be completed. Management of sharps. Dispose of the sharp immediately in the correct receptacle. Safe assembly and use. Report needle stick injuries immediately. And first aid. When you get an injury, irrigate, bleed and cover. And complete an incident form. Report the near misses. This is how we learn from our mistakes. Safe use and disposal of sharps. Consider sharps that are contaminated with patient's blood and saliva as potentially infective. All used disposable syringes and needles, the scalpel blades, and other sharp items should be placed in an appropriate puncture-resistant container located close to the area where they are used. Steps to prevent sharp injuries. Number 1, when you are working, there should be no stops. Handle the needles with care. Step 3, disposing of sharps in an appropriate container. Don't pass the fill line. Number 5, lock a secure container. Step 6, packing small volume containers. And number 7, using large volume container, and the sharp should be picked up by the waste management committee. Avoid to get this sharp injury. So there are certain steps that you should avoid from sharp injury. These are 5 steps. Never push hard into the container. Don't touch the container. Don't break the needle. Don't recap the needle. So these are the 5 steps in which you can avoid injury from sharps. Management of healthcare waste. Healthcare waste includes any material generated by healthcare facilities that may pose a risk of infection transmission. Health waste should be segregated at the point of generation and disposed of according to the local and guidelines. There are 2 types of healthcare waste. Number 1, the risk waste, that is important, such as infectious waste, pathological waste, sharps, the pharmacological waste, genotoxic waste, chemical waste, and radioactive. So this is a risk factor. Non-risk waste which are present in the hospitals are the paper and the cupboards, the packaging, the food waste, and aerosols, that is the sprays. Management of clinical waste. Clinical waste, know how to do it. Ensure it is sorted into the relevant bags. Clinical waste into yellow, household waste into the black, incontinence and sanitary waste into tiger striped bags. Avoid body contacts with bags of healthcare waste. Aprons should be worn. All waste containers should be safely stored and be inaccessible to service users, children, and members of the public. Bags should only be filled 3/4 and secured. Tetanus and hepatitis B vaccination should be available when required. Transportation of the laboratory specimen. This is a very important step because from all the hospitals we have to send the specimens to a reference lab. Transportation of laboratory specimen should follow within the policies that reflect local and national guidelines. The specimen should be taken before starting antibiotic therapy. The specimens must be correctly labeled and packaged. That is, the request form must be kept separate from the specimen in a self-sealing plastic bag. The specimen must be handled carefully, ensuring that the outside of the container is not contaminated. A patient with known or suspected transmissible infection should have a label, either a danger of infection or should write down take special care label. Attach both on the request form and on the specimen. All specimens from the patients with highly dangerous and fatal infectious diseases must not be sent to the laboratory without prior arrangement with the laboratory staff. That is, you have to tell the laboratory that you are sending the specimen, and you have to care of the timing of the laboratory, at what time they will accept the specimen that you are sending, so that the specimen is not lost. The porters and ambulance drivers who transport the specimen must be aware of the procedure for transportation and follow appropriate procedures in the event of spillage or breakage of specimen containers. Thus, there should be segregation of segregation of solid biomedical waste. Non-infective waste, cytotoxic or chemical waste should be put in black plastic containers. Solid waste, that is infected dressings and pop cast, they should be put in red. The infected waste, anatomical waste, that is placenta, pathological waste and body parts, should be put in yellow plastic container. Infected plastics, syringes, gloves and plastic waste, they should be put in blue plastic bags. Sharps, needles and blood gases should be put in this white container. So these are the standard guidelines for the infection prevention and control. I hope you learn from this. You can look at the video again, and inshallah ta'ala, it will give you some basic concepts of how to do it. And last but not the least, you have to practice donning and doffing. In our hospital, what I did was, I organized 3 persons and we told them to do donning and doffing in front of them. This is how you learn. Thank you very much for your cooperation, and thank you for your patience listening. Hope to see you inshallah soon. Thank you very much.